Good morning. My name is Ross Manuel, and I'm going to be giving my presentation on blood counts in pediatric oncology. Before we get started, I'll just talk about the learners that would be appropriate for this presentation. I think that this presentation would be appropriate for new graduate nurses working on a pediatric oncology floor, or even nurses who are in another type of nursing and just moved into pediatric oncology. I also think this presentation could be useful for nursing students. Here are my objectives. After this presentation, the learner will discuss why pediatric oncology patients may have alterations in their blood cell counts, list the signs and symptoms of anemia, thrombocytopenia, and neutropenia, describe ways to minimize the complications related to low blood counts, and demonstrate the calculation of an absolute neutrophil count, or ANC. So, before we get started talking about red blood cells, I'll just give a little background on why these patients might have low blood counts. So the first reason we think about is chemotherapy. Chemotherapy is meant to kill cancerous cells, and it does that, but it also has a side effect of killing healthy cells. And so it can damage those red blood cells, those white blood cells, and those platelets we're going to talk about, and make the patient's blood counts low. So we do frequently check their blood counts when they're in the hospital for these low blood counts, and it's most common about 7 to 10 days after chemo that they'll get low blood counts. Additionally, patients can have low blood counts related to their diagnosis. So leukemia is the most common type of childhood cancer, and it's actually found in the bloodstream, the leukemic cells. So those leukemic cells can actually get so big, and there can be so many of them that they crowd out the healthy blood cells. And this is often one of the things that they present with when they initially come to the hospital and get diagnosed with leukemia. They'll have low blood counts in addition to a very high number of the leukemic cells, or blasts, as we call them. And so they may have come to the hospital because they've been tired, or they've been bleeding, or one of these things we're going to talk about that indicates that their blood counts are low, but the parents didn't even think to suspect leukemia as a diagnosis. So the first type of cell we're going to talk about are red blood cells. Red blood cells carry oxygen, and you might have heard of anemia. Anemia is what we kind of use to talk about low hemoglobin. Hemoglobin is an indicator of how well red blood cells carry oxygen, and that's what we typically use to classify patients as anemic, and it's also how we know when to transfuse a patient generally, is we'll do it based on their hemoglobin versus their red blood cell count for a number of reasons. So some of the symptoms that you'll see with anemia are tiredness or fatigue, headaches, they might say they're dizzy, or a patient may be very pale, or have a rapid heart rate or tachycardia. These are all symptoms of anemia that you'd want to look out for. And as far as treatments go, really we can do blood transfusions, and generally if a patient's hemoglobin is below around 7, we can do a transfusion for that. Or if a patient's hemoglobin is a little higher, but they're very symptomatic, they also may get blood transfusions. For example, if their hemoglobin is 8, but in the setting of tachycardia and fatigue, they may get a blood transfusion for that. The next type of blood cell we'll talk about are platelets. So platelets stop bleeding by forming clots, and a low platelet count is called thrombocytopenia. So symptoms of this, bleeding, bruising, or even little dots on the skin that are called petechiae. They may be purplish in color. They can indicate to us that a patient's platelets are low. This can be dangerous if the platelets are too low, because we think about things like GI bleeds or cranial bleeds. So for that reason, we don't ever let a patient's platelets go below like 10,000, just because those risk of those really bad bleeds goes up a lot. And then if a patient is symptomatic, having any sort of bleeding that we know of, we may actually increase their platelet threshold for transfusion to 20 or 50,000, so that we can keep that patient at a safe level and reduce their bleeding. In order to decrease the side effects of thrombocytopenia, there are a few things that parents can do when they take their kids home if they do have low blood counts. They should definitely be avoiding contact sports. They should also be careful if they're roughhousing too much or even just, playing with their brothers and sisters if it's going to possibly lead to bleeds. Additionally, some people will say that they need to stop flossing because the flossing can actually cause really bad gum bleeds. And then we can tell parents what to do and educate them about what they should do if they get a bleed, such as like a nosebleed at home. We'll usually tell parents that they can try to stop the bleed, and if it doesn't stop for 5 minutes or after 5 minutes, then they need to come into the hospital, because at that point we don't know when it is going to stop. Maybe they don't have any platelets and it's not going to stop on its own. They need to come to the hospital. And even if it's just a drip, if it's continuing for that long of a time, it's problematic, and they would need to come into the hospital for that. But it is good that we can easily transfuse these these patients with platelets. The third type of blood cell we're going to talk about today are the white blood cells. So white blood cells fight infection. And when we talk about the patient's ability to fight infection, you'll also often hear the word neutropenic thrown around. So neutropenic is a low neutrophil count, and neutrophils are just a type of white blood cell. So you'll kind of hear them interchangeably used. And we'll talk a little bit more about the ANC, or the absolute neutrophil count, here in a minute. But when patients have low ANC or low neutrophil counts, they are at really high risk for infections. So they may get fevers, and any sort of infection you can think of, these patients can get. So they can get bizarre lung infections that you would never get if you were healthy. They can get just more common GI bugs or colds, and then they can get bacteremia, which is very scary in these patients and can be very dangerous if not treated immediately. Whenever patients are at home with leukemia or any sort of pediatric oncology diagnosis, and if they get a fever, they have to come to the hospital immediately. Ideally, we start antibiotics in their central line within an hour of that fever. That is shown to really reduce the risk of death in these patients. And I talked for a second about the central lines, but that's another reason why they're so at high risk for the bacteremia, is because in order to be treated for cancer, most patients get a central line, which is really great and really useful, but also increases their risk for these life-threatening bloodstream infections. So the parents have to be really diligent at home about being aware of their kids' symptoms when it comes to their blood counts. Here is just a sample of what a CBC might look like at your facility. So you can see here we've got our white blood count at the top, and it says 1.0, but it's not really one white blood cell. This is 1,000. So you'll hear one, but when people say one, they mean 1,000. And then RBCs, red blood cells, and it says 3.5. Again, it's not really 3.5 red blood cells. It's actually 3.5 million. So just shorthand and easier than putting all those zeros on the lab results. Next, we have the hemoglobin. So the hemoglobin here is 7. We talked about that. That's pretty much the parameter with which we transfuse a lot of these patients. So this patient will probably get a blood transfusion for that hemoglobin. And then platelets, 16. So that's a pretty low platelet count, and that would be 16,000. That's a pretty low platelet count, but depending if they're not symptomatic, we may be able to wait a little bit longer until they're lower to give platelets for that. And then we have our segmented neutrophils and bands. So those are just two different types of neutrophils. So neutrophils, or this is the percentages of the types of neutrophils. So 24% of the white blood cells are segmented neutrophils, and 1% of the white blood cells are bands. That's what this is telling us. So if you add up the segs and the bands, then you're able to get your ANC. So we can go over here now and look at how to calculate an ANC. So in order to calculate an ANC, you add up the percentage of segs and bands and then multiply it by the white blood count. So we've got 24 plus 1 times 1.0, but actually that's 1,000. So we're going to multiply it by 1,000, and then we're going to divide that by 100 to get our ANC. This is something that we do every single day as a nurse on a pediatric oncology floor. Everybody wants to know their ANC because it does indicate usually when a patient can go home. So that's pretty important to families. A doctor, depending on the physician and the patient diagnosis, their ANC might have to be 200 for 2 days or 500 for 2 days. So it is on a case-by-case basis, but we use that number often to indicate when a patient can leave the hospital and go home. So you definitely need to know how to calculate that on a pediatric oncology floor. Now we're going to do a couple review questions just to make sure everybody got the material. So Macy is a 2-year-old patient with leukemia. She finished chemo about a week ago and is back home with her parents. Tonight, her mom noticed a small amount of blood in her urine. What is this likely a clinical manifestation of? So we have neutropenia, anemia, thrombocytopenia, and the red popsicle she ate last night. Alrighty, so our answer is thrombocytopenia or low platelets. That can cause bleeding, and that would be something she'd want to let us know about. So the following day, Macy complains of a headache, and her mom notices that she looks paler than yesterday. What are these likely symptoms of? All right, so this time it is anemia or low red blood cells, low hemoglobin. Great job. Here are my references, and then I really want to quickly just play a video for you guys that's about blood counts and blood transfusions in pediatric oncology patients, but it's geared toward the pediatric population. So it's fun for kids to be able to see videos about themselves when they're having scary things going on in their lives. This website is called the Imaginary Friends Society, and I highly recommend it if you guys know any kids that are going through cancer.
The Imaginary Friends Society presents blood transfusions. Hello there, pal. You can call me Mr. Spikes. Huh? Whoa, stop it. I'm a Tyrannosaurus robot, for Pete's sake. Oh, yeah, that's better. Oh, yeah. Tyrannosaurus robot explains blood transfusion. Tyrannosaurus robot explain. Oh, hi. I'm an imaginary friend of a kid just like you. I hear you're up for a blood transfusion, which sounds intense. But blood transfusions are actually quite common and painless. Before we can talk about transfusions, though, let's talk about blood cells. Blood cells are like superheroes, each with a different superpower. White blood cells fight off bad stuff inside your body. Red blood cells deliver oxygen and other good stuff to your body, and are the most common. See, treatments like chemotherapy zap away the production of red blood cells. So you don't get the good stuff, and it can make you sleepy. Insert good stuff to continue. Insert good stuff to continue. Insert good stuff to continue. Insert good stuff to continue.
1 hour later.
A typical blood transfusion only takes 1 to 4 hours. Best part is, no special recovery time is needed. You'll feel the effects almost instantly and have energy to attack the day. Ha, hoo, ha, hi-ya,
Showing off is the fool's idea of glory.
Whoa!
Alrighty, thank you guys for watching.